you, but I have had a wonderful time in Little Rock, and I have learned a lot, and I'm interested in all that the future holds in this subject. As Adam pointed out, you heard businessman, community person. You didn't hear a lot of medical in that introduction. So I'm just going to be square with you. I'm not medical back. I was a patient one time, and I was a good caregiver for my parents when they needed me. But I would like to get a little bit more detail to you about what Adam mentioned about our project. So I'm going to talk about two organizations, one being our organization, one being another organization in Jackson that sort of are our co-partners in what we're doing. But it will have a healthcare turn to this in this talk. So if you'll just bear with me, you'll hear some healthcare before we get through. So eBeat. If you look to the bottom left there, you'll see this blue globe, and I know you can't see it from there very well, but it says Extension, Broadband, Education, and Adoption Team. And that's why we say eBeat, because that's a lot easier to remember. And by the way, I don't have any fancy websites for you. Mine's just really easy. It's ebeat.ms. So you can find our website. You might find it interesting. eBeat was formed about 18 months ago. This was a grant, stimulus money from Washington to give each state got so much money to do with it what they would like to do for broadband. And I'll tell you about the other group that it was part of the decision is what would be done with it. But the reason I got involved with it is my wife works in the extension service and has for years for Dr. Dan Brook, who's probably the top technology guru in Mississippi for the last several decades. He's very well known, and he retired, and I retired from my businesses, and so he said, you know, I'm going to get unretired. Would you like to get unretired when let's start something new that would be great for Mississippi? And I said, well, if you're going to be part of the team, I'd like to apply for a position for that. So we divided our state into 6 different regions. We have people that are around the state and that live in different localities. I happen to be at the campus at Mississippi State in Starkville at the Bostic building, which is our headquarters. My region, which I'll show you a map. Well, I'll just skip to it so you kind of get an idea of our map. I'm the gray region there to match my gray hair, the 19 counties of northeast Mississippi. That's my area that I generally work from. Well, before I get into eBeat, let me tell you a little bit about extension service, because you may or may not be familiar with that. Mississippi State's, one of their big roles in our state is with an extension service. Every state has an extension service. So when you think of extension, you need to think of grassroots. We have offices in every county, so 82 counties. So we have a lot of employees scattered throughout the state that are really grassroots level. Obviously, you think of things with agriculture, but we do many other topics. In a healthcare area, we have a division that's, you know, family, home, health, that sort of thing, but not from a physician type of relationship. The eBeat is sort of under a technology format and not really anything to do with that. But so extension is grassroots. So this eBeat organization is a new division of the extension service at Mississippi State. And we wanted to go about helping people with their broadband needs in Mississippi. So if you'll let me go to the second organization, I would like to talk to you about a term that we refer to as MBCC, which is the Mississippi Broadband Connect Coalition. And this is a ongoing committee. Actually, it meets twice a year now for a report. We don't work for that agency. We work with that agency. We partner together. The governor of Mississippi at that time, Haley Barbour, appointed Jim Barksdale. Jim Barksdale is a well-known business person around the country. He's the guy that started Netscape, which is now the Mozilla Firefox and so forth. He is a real champion in our state for lots of different things. And he headed the committee with what we could do with those funds with broadband in Mississippi, what would be the best thing to do. And as you can see from the purpose there, it was to improve digital literacy, increase access to broadband, and enable greater broadband adoption. There were 8 committees, and while eBeat was forming, we were starting from scratch with what we were going to name ourselves and what all we were going to do, but simultaneously this group was planning, and they made recommendations. So a little over 14 months ago is when the Mississippi Broadband Connect Coalition unveiled their plan for Mississippi for broadband. And by the way, these are the 8 committees that organization used. Christy Henderson, that you got familiar with this morning, was a very key person, as you might imagine, in the healthcare area. But in Mississippi, the Delta region and a tribal region with the Choctaw Indians sort of had their special committees over there. But for the most part, all around, you can see the different areas of focus: broadband adoption, workforce development, education. You can see the health IT portion there. What we found in Mississippi is that, as it probably is in Arkansas and other states, there is a great digital divide between those that have broadband and those that do not have broadband. And it's been fun to explain this program to a lot of people because, you know, it's sort of like looking at about electricity when it came for the first time. We just assumed that everybody had that. But it wasn't until TVA came along in our part of the world that everyone really have the availability of affordable electricity just about anywhere. And so really we should think of that with broadband that way as well. I'm going to go back to eBeat just a second and tell you a little bit about what we did with eBeat first. The committee, in their report to us, asking us what we could do, well, let me rephrase it clearly. When the Broadband Connect Coalition report came out, we were appointed to be the arms and legs for most of what to be implemented. Some of the healthcare items were not in our area of work, but some of the things that we were asked to do would be to help digital literacy programs to hospitals or health centers, getting some word out on that and so forth, and some other items that I'll go into in my healthcare portion of it. But what we did find is that we needed to probably work in areas other than healthcare for the first portion of our 3.5 years that we had to do this. We felt like that would be the best way to help the most people in the least amount of time. I won't go into a really long part of that, but I do want to share with you a little bit of it because it'll tell you a little bit of the flavor of what I think with healthcare. We worked with libraries. We found that libraries are the lifeblood of the community. I always had a warm and fuzzy feeling about libraries, but I frankly had not given it a lot of thought in other towns in my community till I started visiting them. And I would find out that that's the only place a lot of communities have for internet. So they're 99% of the time they're full. People don't have broadband to do their homework. So I can assure you almost every school night in Mississippi, if you go to the parking lot at the local library, you'll see parents out there in their car with their children to try to do their homework from the Wi-Fi inside the closed library. Okay? Workforce area, you saw one of those as one of the areas. Workforce, Mississippi has a great WIN job centers where people can go and find out about jobs and apply for them. And they have a great way for employers to post jobs, but they don't really have a way of educating people how to apply for them. So we've been doing some of that. We've been working in a lot of areas with government. One of the things that we found out in Mississippi is that there is a company, a national company called NIC, that won the contract for the state of Mississippi to redo all the ms.gov state websites. And so we asked, could we use that as a piggyback to provide websites for local governments? One of the things that eBeat did before we started getting out there is that we did a lot of surveys. We did a 2,400 person survey to get a snapshot of exactly what is the broadband picture in Mississippi. If you were at Christy Henderson's talk this morning, she showed a map of Mississippi that I found most interesting because I'd never seen it before. Do you remember the map that it showed Mississippi and it was white? And she referred to the era, that the way it looks. Well, we're last in broadband adoption. And so I was shocked at that map. But one of the things that I was familiar with maps is that one of the things that we were doing with eBeat is that we provided a map of exactly where broadband, you can put in any address you want to in Mississippi and you'll find out what providers are there and so forth. And it's not a real pretty picture exactly what is out there and so forth. If you go on our website, you'll see where we have a lot of digital literacy programs that we have created and have gone and spoken with different groups and so forth. We, in those 6 different regions that I mentioned to you, that we have regional coordinators, each one of those areas formed an advisory council and came up with their own broadband plan, how to implement it from a local level. Other surveys we did is that we went to Wi-Fi hotspots around the state to identify exactly what the speeds and so forth. That is I didn't hear in any other sessions I went to today, maybe there were some, about what exactly is broadband. Our definition of broadband has got to be at least a minimum of 4 megs down and 1 meg up. Most of the places that we're finding in Mississippi barely even have that. So, what power you might need to send a text somewhere versus sending a video or video conferencing, you're talking about apples and watermelons and so forth. But we have helped cities have a downtown Wi-Fi hotspots. Excuse me, thank you. So we've been really busy doing a lot of things with broadband and educating people about broadband and what it can do to help their life to be easier. The only thing we really had done in depth that it would be anything to do with healthcare really is we've done a lot of information to do with cyberbullying. That is a huge issue in schools and all over. As a matter of fact, we've have a partnership with the Attorney General's office to further that training. We have developed other partnerships with the Library Commission to teach librarians a lot about, everything's going to e-readers and so forth. The Library of the Future is probably going to have a few books in it and other things. Now, let me talk about the Telehealth Park. I understand that I'm now a ninja. I just didn't know that's what it was called. I actually been calling myself the advocate. I mentioned to you that we have 6 of us that are regional coordinators, and we have 2 or 3 people. Dr. Robert Gerardo is our leader. But we've been in our project about 1.5 years now, and now we have our feet on the ground, and we're implementing a lot of the things that we wanted to do. So I have been asked, and I wanted to do it, to be the healthcare. Now let's go out and see what with healthcare we need to be doing with that Broadband Connect Coalition plan. And the last 6 months, I've basically been going and discovering things. One of the things I did to discover, I discovered Christy Henderson. I went to visit with her, and this was back in November, and I will say that was, there's certain things in your life that you say are keys. That totally changed my perspective. I went from someone who was passionate about my fellow man on other things to having a totally different perspective of that this is something that's different. This is something that everybody can win with. Who would not be for telemedicine? I can't imagine it. There are not many things that I do well, but one of the things I do pretty well with is I can problem solve. And I can connect the right people together. And so I have taken it upon myself as not being just, I'm a little interested in this, but I am an advocate and I am a ninja. And I can't tell you how excited I am for what is going on in your world. And I really had called it, we got tele everything. I'd like to be I want to tell everybody about this. I really do. I think it's fantastic. Some of the things that we'd like to do, that we're going to do in a short time that I think will be helpful. So if you'll let me kind of share with you some of the things that are sort of ideas that we're doing. There's a healthcare web link or portal. We're coming up with a final name for it, but it's going to be a separate website. And it's going to be sort of a horse sense way to connect to the average Joe on the street where they can go and find out about, the top things that they need to know about. In Mississippi, of course, it's the obesity and the diabetes and high blood pressure and all those sorts of things. We want them to be able to go to this website and easily find the information they need and websites they can go to, but not have to spend an hour and a half to find out something they couldn't find. We want it to be something that has apps on it where people can, this is something I know would be good for me. Also for e-materials and so forth. I'll go to that page right quick and then come back to that one. We have 5 questions. You probably can't read that too good in blue, but I'm gonna read these to you if it's okay. Where do you go to evaluate and identify your healthcare condition? Where do you go to manage your healthcare condition? What resources can you find to help maintain a healthy lifestyle? Where do you go to find and evaluate healthcare providers? What is the future of healthcare? We want to kind of, the reason I mentioned about the libraries and the WIN centers and so forth, it wasn't that I know that you were that interested in, is because, most of the focus that I've heard so far has been about, is it legal what we're doing? Are people going to pay me? Or is this the technology? But there's one ingredient I hadn't really heard, is that do people really, are they scared of it? Are they wanting to do it? I'm talking about the average person. So I think there needs to be some part where the advocate or whatever goes out and explains to the public exactly what all this is about so that they would adopt it and accept it. So hope you kind of get a feel of this healthcare portal we're going to be. And as I explained when I sent this PowerPoint in, we're not trying to give medical advice. We are trying to connect people to where they can find some answers to what they would need to know about to see if they should go to the doctor or so forth. So things that are already readily available if they just knew where to go to get it. Now the next thing here is Msu Extension Infrastructure. Now what in the world is Chip talking about? Why would that be important? Well, this is an idea, and I don't know that it would come to fruition, but hear me out on this. I was very excited to hear about your Arkansas infrastructure that you had. That was really exciting. We don't have quite that in Mississippi, but what Mississippi State has that could be of some help is our infrastructure. In extension service, in the department that I'm in, has nothing to do with the EBEAT project, but we're the Center for Technology Outreach. Okay, and We have video conferencing in all 82 counties. We have great facilities in most of the counties where you could have huge meetings. A lot of training could be done throughout different, for various education about all this and so forth, and training people. There is a Mississippi Telehealth Association that we're wanting to form, and we want to be a part of making that happen. And we want to partner with some of our agencies and so forth, of which Christy Henderson is one, and I will tell you we've had an agreement today on a few of the items. So this has been a fruitful day in a lot of ways. So I hope you got the gist of what I was talking about. We are about health care, but in a totally different way than you've heard it from the rest of the speakers. But I thought it was ironic, a lot of things that were in your previous presentation, the end result is some of that is a little bit of alike. We've just kind of gone about in a totally different direction. Any questions?